Hello everyone, this is Chadi Alraies from CVI 2022 in Denver. I'm really delighted today to be with Dr. Vikas Aggarwal from University of Michigan. He's been an expert in the pulmonary embolism management and he is doing a phenomenal session at CVI. Vikas, always nice to see you.
Always.
Yeah.
Thank you for the invitation.
Absolutely. You have been an expert in the pulmonary embolism, but there is something called about chronic pulmonary embolism management. Give us more insight about the topic.
Yeah, so pulmonary embolism for long has been thought of as like, quote unquote, a one and done disease.
Yeah.
It's an acute presentation, and those who do well in the hospital, as you know, get anticoagulated traditionally, and it's believed that that's all they need, and we are now realizing that's not true. And recent data is suggesting that this entity, post-pulmonary embolism syndrome, so is a real thing. And chronic pulmonary embolism is one clinical phenotype for this syndrome. These are patients who don't have complete resolution of their acute clot, and they end up having chronic obstructions, occlusions in the pulmonary artery branches. Some of them end up developing really bad things like pulmonary hypertension.
Correct.
The so-called chronic thromboembolic pulmonary hypertension.
Correct.
Traditionally, the treatment for that, disease has been open heart surgeries, pulmonary thromboendarterectomy, limited to very few selected patients, selected operators and surgeons and centers. But there is a huge need for other therapies for this chronic PE space, a huge need for data and improving our understanding.
So how do you identify it and when we can refer to experts like yourself for management?
Yeah, diagnosis and screening is a big deal.
Yeah.
You have a patient with a history of hypercoagulability, DVT, PE, who has just never recovered from their acute illness, is still symptomatic, no good explanation. Please don't blame those things on the fact that they smoke or they're obese or,
It's always some.
Screen for chronic pulmonary embolism, and the best test for that is a ventilation perfusion scan.
Okay.
Readily available, low radiation dose. But a ventilation perfusion scan can help identify residual chronic pulmonary vascular obstruction.
Right.
And if you see those things, that doesn't mean they all need surgery or angioplasty, but the one thing they need is a good evaluation after that.
Absolutely.
So with an echocardiogram, a referral to an expert pulmonary hypertension center.
Yeah.
There are more than 30 of those, nationwide, easily identifiable from the PHA website. And then you leave it up to those doctors and they'll figure out
Just so
who needs
briefly,
what.
I know we have limited time, but briefly, what is the contemporary management for this cohort of patients, which is very sick, but yet very small few centers in the United States?
Contemporary management involves, everybody needs anticoagulation. On top of anticoagulation, endarterectomy surgery for those who have obstructions and blockages proximally that a surgeon can access, or pulmonary angioplasty for those who have obstructions and blockages that a surgeon can't access, or the patient is not a surgical candidate for other reasons. Those are the three big things: anticoagulation, angioplasty, surgery.
So the biggest buckets are identifying these patients who are at risk for it, screen for it with a very easy, readily available tool, the VQ scan, and eventually refer them to experts that are known in the United States.
Yeah, 100%.
Dr. Aggarwal, thank you so much for your time. Really appreciate your time and expertise. Please watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver.
Thank you. Take care.